Hey, welcome. My name is Jeff Harrison, and I'm your host for Your Personal Health. And I am very excited to be back. These two guys have been working like I don't know what they're just working overtime and helping people and like you and me through this pandemic. And I've been to their location in Rancho Mirage a couple times, and I can see Dr. Kim out there going from car to car to car in the parking lot helping us out. And I'm just excited to be back. Dr. Kim, Michael Kim, and Dr. Krista Burris, welcome you guys.
Thanks, Jeff.
So the name of the show is Your Personal Health, and
Hey,
you
Mom.
know let's just start with some basics here. And what I mean by that is, one of the most sought after questions when it comes to healthcare, and I know this kind of sounds silly, but it's what is a primary care physician?
A primary care physician is, in the old days, people would call them GPs or their local doctor. And really, it's the doctor that takes care of your everyday problems. So, the person that you would go to with a small injury or a sore throat, someone that would know about your, um, overall health. This is really the person that in our modern health system has taken the role of a coordinator.
Mm.
And I feel like that's a part of what a primary care doctor is, but it's an unfortunate transition in that um, many doctors have just become the person that you have to get something from in order to go get what you want. So you have to get a prior auth or a referral to go to see a specialist. So in its sort of ideal state, a primary care doctor is actually the doctor that coordinates things and um, sort of is like the head coach on a team. You might need to occasionally go and see a specialist, but your primary care doctor and your specialist should be in conversation and should know what's happening. Um, because what a specialist does may affect other areas of that patient's care. And unfortunately, in our current system, often what happens is if someone has a primary, they're very difficult to get into because they're assigned really large amounts of patients. And so either they see a doctor who's just seeing same day visits, maybe they see a different doctor, maybe they can't even get in. Um, and then when they do see their primary care doctor, they're sent off to 3 or 4 specialists and don't come back and see their primary doctor for an entire year. That's that's something that I've seen more and more, and not the role a primary physician really should be taking.
Well, with that thought in mind, Dr. Kim, when that happens, where do you see that leading us? I mean, to me, it seems as you're describing that, Dr. Burris, it almost feels like the the whole idea of a family doctor is almost like last century's terminology, but it feels like it's I've become so disconnected that if I have a splinter, I have to go to a specialist who specializes in removal of splinters, when really that's not the case. Dr. Kim, how do you see this playing out? And as far as the average family out there, what's the role that they want a family physician to play, or a GP, or in this case, a primary care physician?
Yeah, so I think ideally everyone who is in primary care, who wanted to go in and who wants to go in, you know, um, likes that the ability to take care of of a person's individual needs, and so there are a lot of things that you should be able to take care of at your primary care doctor's office. But due to various things, such as the number of patients that we need to see to keep the lights on, and the paperwork, and um, the overall time it takes for some of the patients, most primary care doctors are farming out everything that they want to do. And in case in point, we have someone who has come into us and was seeing a primary, but he was getting his medications from his heart doctor, and then from his urologist, and from his GI doctor. So he would have to track down 3 different offices every time he needed refills, rather than going to his primary to get the refills, and having his primary coordinate care with his specialist, and which is silly, because now as a consumer you're just running around trying to get what you need, versus having a centralized area where things are in and out and it's more streamlined. And so I think the healthcare system is breaking down in that sense, and that it's all getting to at the end results, and now you're having to see 10 places in order to get your medicine. So that's kind of silly, I think.
Well, if you're just joining us, this is called Your Personal Health. I'm Jeff Harrison. I'm here with Dr. Krista Burris and Dr. Michael Kim, and they own a program called Coachella Valley Direct Primary Care. And before we go any further, if you'll just take a second and just explain, first of all, what is Coachella Valley Direct Primary Care, and what drove you to take this path versus the normal, what we think normal of becoming a doctor and working in an office or whatever, and just give us an overview. Dr. Burris, you want to start us off with that? What is Coachella Valley Direct Primary Care?
Our office is a model of medicine called direct primary care. It's been around for over 10 years, and it is gaining popularity, but for a lot of people it's new. And so we do spend time explaining what it is. Direct primary care is a membership model where the patients actually join the practice and pay a monthly membership. And then because they've joined the practice and they paid that monthly membership, they are able to access the primary care for that one fee. This is not insurance. So we spend some time and carefully explain the difference. It just sort of carves out the primary care portion of somebody's healthcare, and we can take care of it for a very reasonable amount of money. But it allows us to operate free of the dictates of insurance companies, which often are actually set up to favor specialists and really disfavor primary care doctors, and has turned primary care into just almost like a factory where it's really difficult to provide comprehensive care because you have to see so many patients. In direct primary care, because we're outside of that model, we're able to really focus on the patients that we do have, spend more time with them, do more comprehensive visits. And because we're not having to bill insurance, we're able to do it in a way that makes the most sense for the patient. And it's a really kind of fun way to practice medicine. And a lot of what we thought when we were students going into primary care that we'd be doing, actually finally am getting to do. So I've had a couple moments where I'm like, oh, yeah, this is great.
Well, I just have to share a very personal example, I guess a testimonial, since my wife and I are both patients of Coachella Valley Direct Primary Care. Recently my wife had contacted you because she had taken a fall, and she's a yoga fanatic. I shouldn't say, I don't mean that in a negative standpoint. She's very dedicated to yoga practice, but she was noticing her wrist was hurt from her fall. And I thought it was so handy because she just called. I think she talked to you, Dr. Kim. I'm not sure exactly, but she just picked the phone and called you guys. And you said, hey, you need to go have an x-ray done. And I think you guys even set that up. And then once it was done, the gal told her it was going to be a few days before she would hear back. And I think it was the same day because Dr. Kim had already gotten information and you had already responded to her. And to me, that was like, wow, that was, I mean, I get little chill bumps just explaining, because that's the way it should be. It feels like that's the day of old that can live in today's environment, because you helped, as you said at the very beginning, Dr. Burris, you were the coordinator, and I never thought of a primary care physician being in that role. It was almost like, hey, you need to go see somebody, and now it's up to me to go, thumb through the, search results on, I need to see a doctor on my knee or my hip or whatever. And I just want to say how great that was in the experience. And my wife is back to doing full-time yoga because now she knows, because the exercise she was giving and knowing it wasn't cracked or broken, it's peace of mind. So thank you very much. Dr. Kim, when you are actually doing your job as you're doing now, what's the big benefit for us as your new patient, as a new client of Coachella Valley Direct Primary Care, that we may not see as someone just in the system, if you will?
Right. So, I guess direct primary care came about because there are multiple problems in primary care right now. And it's just a very complicated system for everyone. And so primary care doctors, just like us, wanted to be able to just be someone's doctor and not make it so complicated. And, be there when people needed help, because part of primary care is definitely the routine, the making sure you're getting your screenings, but it also is part of when people get sick or injured, that's not scheduled. And so going to urgent care is not a good option for a lot of people. And so being able to have people call us and text us, and being able to handle things and not having to have people come in, because many things we can handle in medicine by just asking good questions or looking at pictures or doing, technology has come such a long way. We can take care of those things. And so the other part is, having the time to be able to navigate the system on behalf of patients, and not just having them out there and hoping that they contacted their specialists. So those are, I think, some of the key points that direct primary care is fixing.
Well, I think first of all, I think you're too modest, because I think it's like this. I had to go into LA on Monday, and I had somebody go with me. Rarely I travel. I mean, normally I travel this by myself. And I looked over and said, I'm really glad you're here. And I said, but please don't take this wrong, but not for the reason you think. It's I get to drive in the diamond lane now. And they laughed. They said, oh, I get it. And to me, it feels like I have this, when you said text or call you, I mean, some people say like, yeah, right, that, I'm just going to get Judy in the office and I'll be passed to this person. And I feel like I have this special, pass that I can, if I really needed something, I could call you and one of you guys are going to answer. And the two times I think I have done that, you said, come on over. It wasn't like I'll see you in 2 weeks. It was like, come on over that day as soon as I get there. And I think that is the beauty of Coachella Valley Direct Primary Care and the service that you offer. How do your other patients respond to that, Dr. Burris? I mean, is that pretty common, or I'm the only one that gets that excited?
No, actually, that's something we hear quite a bit. People are often quite surprised that there's a human being who answers the phone, or that they get a response back. Because, occasionally they do go to voicemail, but they do get answered, and often answered in a way where it's not like, oh, we'll get back to you in 3 days. It's we want to take care of a problem as fast as possible for people.
Mm-hmm.
But I have, one of the reasons that we set the practice up this way is we always want to be able to get people in within either same day or next day when they need it. It's the type of thing that we don't ever, if the practice grows to the point where we're not able to do that, that means we need to expand a bit, because that's part of the type of practice that this is, and the way the model's been set up, that type of access is part of what we offer.
While you're there, what do you see that has during this pandemic process, has this impacted your business in a different way? Because the reason I ask that is because I know across the country, we've talked about this before, there's a shortage of primary care physicians. And I've had conversation with friends, and they're saying, well, yeah, we had to do this and do this to try to get a shot or get the vaccine or get a doctor. I'm like, all you got to do is go to Coachella Valley Direct Primary Care and they'll get you right in. And they're like, yeah, right. No, we had to drive to Beaumont. I'm like, that doesn't have to happen. So in that, what has changed, or is anything shifted because of the pandemic?
I'm hearing more than ever people having problems accessing their doctors. Of course, it's not all the doctors, but there are a fair number of doctors who've either retired or even gone to only virtual visits, or who are requiring people get tested before they come in for an appointment, which again just puts a little extra barrier up. And not all doctors' offices are doing that, but there's a fair number. I hear the stories often enough that it's more than a handful. So I think the pandemic has really, really sort of accelerated the pressure on the primary care system, both with early retirements and just decreased access of an already limited resource. So we're seeing more patients in that type of category who maybe up until now were pretty happy with the care they were receiving, but now they can't access it.
Dr. Kim, when you're setting up your business, when you have your business set up as you do now, tell us what that looks like. I mean, I'm very familiar with it because my wife and I are both patients and clients of Coachella Valley Direct Primary Care. But give us an idea how that's all set up.
Sure. So we have it set up during this pandemic where we can set everything up virtually. We can send you to an online link, and we can send you our contract, and we can talk about it, and we can call you and get your information and get started on your road to being healthier. That being said, also we can have you come into the clinic and do it all in person. So however people feel comfortable, because we do want to make sure that we're not contributing to the pandemic in terms of spreading the COVID. But from age 0 to 45, it's $99 a month, and from age 46 and above, it's $145 a month. And there are discounts for additional members on there. And with that, you don't pay anything extra in terms of what we offer. We do offer basic labs with that, so you don't have to feel like you're only getting a doctor. There are other things that we have negotiated with other entities for radiology services and whatnot. So if someone doesn't have insurance, it's not a requirement for us. We encourage everyone to have some form of insurance, because there are some things we just can't do as primary care doctors. But that being said, there's a lot that we can do, and medications are very cheap. And so we want to be able to help people get healthier. And so there are no co-pays when you come in. If you need, a school physical or sports physical, whatever you need, it's all within there. So there's no extra that we charge people for what we do.
Talk to us about the process of. You said there's no copay. I noticed whenever Carmen, my wife, went in, it was there were no additional fees. Although I do know that I'm a little off track here. I'm sorry, I had somebody else talking in my ear there for a second, but we're talking about the program. So getting started is 45 or 0 to 45 is $99 a month, and then after that 46 is 145 a month. What other things that we would be covered for, or that we would expect to pay when we come in? You said there's no co-pays, no office visit fees, or anything of that nature?
No.
No. And within the realm of primary care, the basic labs, things like your metabolic panel, cholesterol, complete blood count, things like that, are in-office testing that covers the basic things. So if someone needed a urinalysis, I mean, it's part of the services we provide. We also do provide some additional services at a very reduced rate. So what we try to do for services that are not covered is charge people our cost. So we're able to go out and get relationships with other places. For instance, if someone didn't have insurance and they needed extensive blood work on a specialized panel, we've negotiated very good rates for that, so we're able to pass on that savings. Sometimes even just sitting down and going through someone's med list. I did that with a patient who didn't have insurance, and I was able to save her about $300 a month on her drug costs just by shifting the pharmacy that she was using.
Wow.
So there are ways that we can find to sort of help people save money on their health care that maybe you didn't even know were possible, but just sort of having someone who's been around the block in the system a while sometimes will be able to spot things like that for our patients.
A two-part question, then we'll wrap it up, because I know you've got a full load. First of all, who are the ideal people as you're describing something? And wow, in normal times we would have a lot of snowbirds in town, a lot of Canadians, and is your program something I have to sign up for, and it's a 1-year program, or is it a month to month? Is this a good thing for people who are traveling in and out of the desert, since we are a destination facility or property, or is it not?
No, I think you're correct there. Someone who's probably going to be here more than a month is going to be someone who's ideal for us. Someone who calls this either their primary home or their secondary home. And so, if you're here for 3 to 6 months, a lot can happen at that time. And if you don't have a primary care doctor here, it is hard to access specialists and the healthcare system, because your doctor who's in another state can't practice within the state of California. So people who come here from different states or from different countries and are going to be here for a little bit, we do, our contract is a month-to-month contract. You're not locked in for 6 months or a year. And so, we do hope people stay with us, long-term, because that's what primary care is. But I think it does make sense, if you're going to be here longer than a month, at any given time, to have someone, like you said, to be able to call, to be able to coordinate care, even though you might not use it the time you do need it. A lot of people are thankful that they're able to call.
Well, Dr. Burris, Dr. Kim, thank you so much for being here today, and kind of shedding some light on, hey, what is a primary care physician and how that really works into the total care of an individual or their family, and making sure that we stay healthy. What I love about what you do is you look at the overall health. It's not just, and again, stop me if I'm wrong, but you as primary care physicians, you're looking at our overall health, and you not necessarily don't just want to see us when we need you, but you're there to guide us to optimum health. Is that fair to say?
Yes, absolutely. We want to sort of meet health needs, but also help people to start thinking about health goals. And it's something all of us, most of us have really busy lives, and there may be things that just haven't gotten around to. But when you have a little bit of support, you might be able to tackle something like, I've always wanted to see if I could get off this medication, if I, change my lifestyle, or I wanted to work on getting my fitness level up, or, wanted a little help with the diet, or thought, I wonder, if this ache and pain is a problem or not. Can I actually address it? Sometimes thinking that way has been sort of more in the realm of like wellness people, but honestly, it is part of what primary care doctors do, is sort of help you set those health goals. Maybe you want to quit smoking, or become more active, or whatever it is. We're there to sort of help people set those goals, help them come up with plans to meet them, and look forward to a healthier future.
I love that. Well, if you're ready to make that type of a shift, the information is on the screen for Coachella Valley Direct Primary Care. You can call them at 760-642-5549. This is a live show. Call now. I'd love to hear that phone ringing. Or you can go to their website at CoachellaValleyDPC.com. That's CoachellaValleyDPC.com. Guys, I want to thank you so much for all that you do. If you did miss their primary or their show before this about the COVID-19 update, I don't even know exactly how many you've done, but it's been almost a year since this whole thing has started. And I think you've been with us probably almost every week, giving us an update. And today, if you missed it, jump back over there on their website, on their Facebook page, and check that out, because the numbers are going lower, but we still need to stay diligent. And I just want to thank you guys for being there.
Thanks,
I
Jeff.
want to thank you too, Jeff.
All right, we'll see you all next week. And again, stay safe out there, keep your distance. And if you need a direct primary care, if you need a primary care doctor, and you right now are just linked there, I love that. That's the phone ringing. People calling in saying, I want to join right now. And you're not happy anymore about going to urgent care or emergency center as your first line of healthcare. Check out Dr. Burris and Dr. Kim. They are there to help you. Again, we've been members now for a while, and we are extremely happy, and I couldn't recommend them any higher. So get out there and do that. Their number, 760-642-5549, or Coachella Valley Direct Primary Care, and check them out. Until next week, my name is Jeff Harrison. Dr. Burris, Dr. Kim, thank you so much.
Thank you.
Thank you.